welcome to Your Health with Dina Khader. I'm Dan Rubidoux, and today I'm going to be talking to Dina as she's just gotten back from Europe for the final leg of becoming the first United States practitioner to be certified by the European Institute for Personalized Prevention. Did I get that right?
Yes, you did, Dan.
Okay, great.
In genomics.
In genomics. And
Yes.
can you tell us a little bit about what you did there?
Absolutely. Actually, it was a three-part series of very intense seminars learning about genes and how they interact with each other, which we call gene-gene interactions, also gene-environment interactions, and understanding the different types of genes that exist, and learning the fact that there's more than one gene. You don't just have one gene for, let's say, heart disease or one gene for blood pressure. There's a series of several genes, even for Parkinson's and Alzheimer's. So it was really fascinating information. And
but a lot of information to take in, it sounds like.
Yes, absolutely,
yeah.
Absolutely. And just understanding how that applies to the individual, for the patient that you work with, and designing a nutritional plan for them, as well as, what supplements might be of use to them based on their individual profile.
Now, profile, what do you mean by profile?
It's actually a genetic profile, and what we find through that is what genes you have inherited from your parents or grandparents, and the way those genes are being expressed. So you actually understand which genes are being overly expressed. Mm-hmm. So for instance, if you have an unhealthy gene that's being overly expressed, how do you actually quiet it down? And if you have another gene that is not expressing itself sufficiently, what can you do to help upregulate that gene?
Okay, so you're turning down the bad genes, up the good, that sort of, that's
Exactly.
probably oversimplified, I know, but
Right,
that's
right.
it. I've heard a lot about genetic testing lately. I think, it's kind of one of those buzzwords now. A lot of people are talking about it. And to be fair, it's getting some criticism that we're jumping ahead of ourselves technologically, that it's not very helpful for diagnostic uses. How do you respond to that? Are those fair criticisms?
Actually, I agree with a lot of those criticisms, Dan. In fact, some of the companies that actually have come out with DNA testing, when I've actually looked at them carefully, they actually blatantly come out and say, well, this person is going to be at risk for diabetes or risk for cancer and so on. And that's not what this is all about.
Okay.
So it is, a lot of these companies have just been, coming up with these ideas of how to diagnose patients. And really, this type of tool is not for diagnosing, it's simply for prevention. You're really looking at the individual, what genes they've inherited, what you need to, how do you optimize the healthy genes, and how do you really quiet down the unhealthy genes? And that's really what that's all about. So just because you might have a couple of genes that might be that could express for osteoporosis, it doesn't mean you're going to necessarily get osteoporosis down the road. You've got to do an awful lot of wrong things to get there.
Okay. So you've been working with the IEPP, the European Institute for Personalized Prevention. How do they do things differently? I hear what you're saying as far as your criticism of some of the other ways it's being done. What's different about Dr. Baranova and her technique?
The difference is that it's not a commercial lab. Okay, and Baranova has tremendous credentials, and she's very well respected in Europe. In fact, she's considered the expert in genetics in Europe. Genomics, as we like to call it as well too. And she in fact has a panel of doctors who analyze the genes for her when they do the testing.
For each individual?
For each individual,
wow.
Yes, absolutely. And then that's why it takes time to get the results. It takes at least a month to get those results, because
Sure.
there's so many people looking at that one DNA blood sample.
Well, it sounds like it's a real process, but I would imagine then that information you get back is far more useful.
Absolutely, and it's much more in-depth information that we get.
Now, can anyone have that done, or do you have to be a practitioner? You cannot. You work directly with them. You're certified. Do they only work with actual practitioners?
Yes, absolutely. They only work with practitioners. So you do have to be a practitioner working with them.
So someone can get this
closely.
done on their own. They would need to see someone.
Absolutely,
Okay.
absolutely. And the information is extremely valuable, because it can tell you. Let's say you have both parents who have diabetes, and then you're concerned about having any risk for diabetes down the road. Well, by doing this kind of testing, you'll know, do you have a risk? Do you have to be careful of your sugar intake? So it's really confirmation in many ways.
And that's just one example. I'm sure.
Exactly. There's several examples of what else you
tell
can
us
do.
about some of those things. That I think is ultimately what a lot of people are interested in. What information can I get from this genetic testing? How is it going to help me?
Well, you can see if you've inherited any genes for osteoporosis, for instance, for heart disease, for blood pressure, I know a lot of people are very concerned about Alzheimer's and Parkinson's, and in fact there is a gene called the APO4 gene, the number 4, and that's the one gene that makes you at a higher risk for Alzheimer's. But the good news is that there's things you can do nutritionally to help, you know, reduce that likelihood of developing Alzheimer's.
So the idea is it's not diagnostic so much as it's preventative. You find out what you might be at risk for.
Exactly.
But it doesn't, just because you're at risk for something doesn't mean you'll necessarily get it, but you can certainly take steps
to prevent that.
Sure.
And to minimize the chances of developing that condition.
As far as what are some of the most important things people are finding out about? I mean, I know things like Parkinson's, Alzheimer's, the high blood pressure certainly are things people are concerned about. Is there anything else that you get back that you can do a lot with that maybe people aren't looking for?
Right. Well, one of the fascinating things about the gene testing is that we can also see how the liver's ability to detoxify chemicals through the environment are. So, for instance, the lab will tell me, well, this patient, of course, has an 80% ability to detoxify chemicals, while another patient has only a 20% ability to do that. And once you have that information, you know who are the patients that are going to be at a greater risk for possibly developing cancer down the road or other serious diseases, and how you can play around with that to really suppress the phase 1 genes, because the phase 1 genes in your liver are the genes that make you much more likely to develop a serious condition as you age, and the phase 2 genes, on the other hand, are the ones that help protect you from developing those conditions.
So the idea is to enhance the genes that support phase 2 and quiet the genes that support phase 1.
Absolutely, you got it.
I've heard you speak before about how important that liver detoxification is in the overall health and the ability to prevent diseases in the future. So that's certainly a big preventative issue.
Absolutely, because then we know which individual needs to properly detoxify on a regular basis, like once every 3-4 months, as opposed to another individual who once a year would be all they might need to do.
This is fascinating, and I know you had a lot more to talk about on this. I know one of the things you mentioned was hormone replacement therapy, and I know that's something that a lot of people think about, and that's something we should definitely get to, but I think we'll have to call this one to a close. So I'd like to thank you again, Dina. As always, it's fascinating information. Thank you for joining us, and we hope to see you next time.